Namaste viewers, welcome to Sri Anantha YouTube channel. Today we have Professor Dr. A.V. Srinivasan Swamiji with us, who will explain about the various diseases which can be treated by Marmachikitsa. Swamiji, can you please explain to us what type of diseases can be treated by Marmachikitsa?
Embodiments of love. Today we are going to share with you some valuable information regarding the disease and how it can be prevented, managed, and it can be cured through Marmachikitsa called Varmology. If you see, we have two types of diseases called communicable diseases and non-communicable diseases. In communicable diseases, majorly the foreign pathogens affects the immunity of a person. With that, he develops so many dysfunctions or disorders in the organs. For instance, in case of tuberculosis or extension of that called COVID, such cases are communicable. HIV, which is communicable, all these cases definitely gives much adverse impacts on the human body. So such cases can be cured definitely through Marmachikitsa, and intervention of Marmachikitsa definitely boosts the immunity of a person in the communicable diseases and completely it detoxifies and kills the bacteria in whichever organ it is been spread. Now, the case of non-communicable disease, what are such ailments can be there? Any person generally suffers with hypertension, which leads to blood pressure, and similarly that may have the impact over the aorta, which later leads to cardiovascular disease. And similarly, if you see, some people may have the respiratory issues. It may be inflamed through communicable diseases, or just because of some infection, it can make quite adverse impact over the lungs, with which the respiratory disorders and dysfunctions may take place. So such cases and gastrointestinal disorders or dysfunctions, any such cases can be cured with this. And similarly, any person having any kind of stenosis or thrombosis, deep vein thrombosis, it can be cured through Varma technology. Now finally, another two variations have been made, that is, whatever the acute and chronic cases which comes up, that has been named as trauma cases. In that trauma cases, it can be either accident, road accident, or any cardiac arrest or brain stroke. So this intervention of modern science is most important in the preliminary, in the first stage. After that, we are there when the immunity is lost for any patient, such patient who met with an accident or any kind of dysfunctions of the organs, like if related to the musculoskeletal disorders, after injury they unable to withstand, they unable to walk, or if they are on the wheelchair, such peoples, we definitely improve their immunity and stability of the bones, and they may able to walk with the support of a stick or a walker, or if it is a mild after the accident also, we try to cure 100%. Similarly, the case of heart attack, so myopathy, if it is there, then heart may be, valves may be blocked, all the four valves may be blocked. In that, the ejection fractions will become less, and hardly 31% to 35% most of the cases we can find. For such people, they can have the Marmachikitsa after their surgery like stent or open heart surgery or whatever it may be. After 6 months, we give them a beautiful treatment. With that, the ejection fractions can be improved from 31 to or 35 to 38 to 40%. even recently we have given a treatment to a patient where the patient had only 50% of the ejection fraction. Now the level has been raised up to 68%. So in this way, any such trauma cases can also be taken care after 6 months of their surgery. Similarly, now cancer. This is also a case of trauma, where in such trauma cases what we do is, after the radiation and the chemotherapy is over, we give a gap of 6 months. The reason is that they have to develop their immunity, and if they further required any kind of radiations or chemotherapy, we permit them to go for such treatment through conventional system. Once when the conventional systems ends up and says that more chemo cannot be given to a patient, at that stage we ask the patients to come and take the Marma therapy, which helps them to burn all the bad bacteria and gives a new blood cells in their body and removes all the toxins and builds their immunity. So in this way, the communicable or non-communicable or trauma or non-trauma cases, all for the diseases, ailments, we have the solutions. And in the non-communicable and non-trauma cases, we give verily the treatment procedures will start, whereas in the trauma cases, after their surgery, post-surgery, we take up the case and give them the best results within 15 days, 10 to 15 days. So all these procedures in the trauma cases, it takes from after 6th month. So in the non-trauma cases and non-communicable disease cases, we give the solution immediately when they admit in our hospital or clinic. So I think it is the valuable information to all the viewers, and definitely all you can avail the benefits of our treatment protocols. Thank you.